Hello, and welcome to podcast episode 4. Today I will be discussing nursing ethics, specifically the ethical principles of patient autonomy, beneficence, and non maleficence. As I prepare to become a RN, I recognize that ethical decision making will be something I encounter every day, often in situations where there is no obvious right answer. I chose the topic because I want to better understand how to balance these principles while still advocating for patients and providing safe care. Nursing ethics provide a framework that guides nurses when making difficult clinical decisions. I chose to focus on patient autonomy, beneficence, and non-maleficence because these principles seem to be at the center of most ethical dilemmas for nurses. Patient autonomy being competent patients having the right to make decisions for their own care, even when those decisions may differ from healthcare recommendations. Beneficence encourages us to act in a way that promotes well-being, while non-maleficence reminds us to avoid causing harm. Throughout my research, I learned that ethical nursing practice is much more complex than just following a code of ethics. The literature emphasizes that ethical decision making requires critical thinking, reflection, collaboration, and strong communication. I also learned that respecting patient autonomy doesn't always mean agreeing with what the patient's decision is. Instead, it involves ensuring that patients have the information they need to make informed choices while supporting their right to decide. Beneficence and non-maleficence often require nurses to carefully weigh the potential benefits and harm of different interventions, and recognize that there's not always a perfect solution. So the article by Chiraghi et al. Highlights the importance of centering beneficence in nursing care as it results in increases in health outcomes, improvements in health outcomes. And one of the biggest takeaways from my research was that ethical nursing is less about trying to find the correct answer and more about using ethical principles to guide difficult decisions while keeping the patient's values and the patient at the center of care. So, relational inquiry shaped my understanding of nursing ethics because it reminds us that ethical decisions can't be made just by looking at a diagnosis or a situation in isolation. Every patient brings their own beliefs and background that are going to influence the decision they're going to make. Relational inquiry encourages nurses to consider contextual factors rather than focusing solely on clinical outcomes. It also highlights the importance of developing therapeutic relationships built on trust and empathy. And by understanding patient perspectives, nurses are better able to advocate for their wishes and balance those ethical responsibilities and provide safe care. So for lingering questions, I still have questions about how experienced nurses navigate situations where ethical principles are conflicting. I wonder how nurses balance respecting patient autonomy when they strongly believe a patient's decision could result in harm, and how they cope emotionally with situations where they disagree with a parent's choice. I'm also interested in learning more about the role of ethics consultations and work with the interdisciplinary collaboration to resolve these dilemmas. Like, who's involved in that committee? What do these hearings look like? So this is an area that I hope to continue to explore and gain more experience and practice. But overall, researching nursing ethics has reinforced that being a competent nurse requires much more than just strong clinical knowledge. It requires thoughtful decision making, compassion, and the ability to advocate for others. As I prepare to enter practice as an RN, I hope to continue developing these confidences in the ethical decision making and seeking guidance from experienced colleagues, reflecting on my own challenging situations, and always approaching patients with empathy and respect. Thank you so much.